Hi, my name is Emily Pazmiño, and today I'm going to talk about transcatheter mitral valve repair in patients with heart failure. Definition. In these patients with heart failure who have mitral regurgitation due to left ventricular dysfunction, the prognosis is poor. Transcatheter mitral valve repair may improve their clinical outcomes. Transcatheter mitral valve repair is a minimally invasive technique for treatment of selected patients with symptomatic chronic mitral regurgitation.
The prognosis in patients with heart failure and secondary mitral regurgitation is poor. Although surgical mitral valve repair and replacement have not been shown to reduce hospitalizations or death, transcatheter mitral valve repair may improve clinical outcomes. In this multi-center randomized controlled open-label trial, 614 patients with heart failure and moderate to severe or severe secondary mitral regurgitation who remain symptomatic despite maximal medical therapy were randomized to transcatheter mitral valve repair plus medical therapy or to medical therapy alone. The primary efficacy endpoint was all hospitalizations for heart failure within 24 months. The primary safety endpoint was freedom from device-related complications at 12 months. A key pre-specified secondary endpoint was all-cause mortality within 24 months. The annualized rate of all hospitalizations for heart failure within 24 months was significantly lower in the device group than in the control group. At 12 months of follow-up, 96.6% of patients in the intervention group were free of device-related complications, exceeding a pre-specified threshold. All-cause mortality within 24 months was lower in the device group than in the control group. The authors conclude that among patients with heart failure and moderate to severe or severe secondary mitral regurgitation who remain symptomatic despite maximal medical therapy, transcatheter mitral valve repair may improve clinical outcomes. Full trial results are available at nejm.org.
Applications in medicine. Transcatheter mitral valve repair may be an option in patients with severe symptoms. Severe primary mitral regurgitations who have a favorable anatomy for repair and a reasonable life expectancy, but in whom the mitral valve is not favorable for repair and reasonable life expectancy, but in whom the surgical risk is prohibited and medical treatment insufficient.
My name is Matthew Chung. I'm one of the structural and interventional cardiologists here at Virginia Cardiovascular Specialists. And in this video today, I'd like to discuss MitraClip or transcatheter mitral valve repair to treat severe mitral regurgitation. Mitral regurgitation can be identified in a number of ways. Sometimes it's when a patient's doctor hears a murmur and then they obtain an echo which demonstrates that they have a leaky mitral valve. But oftentimes it becomes noticed because of symptoms. And so the symptoms of mitral regurgitation are very similar actually to the symptoms of aortic stenosis. And so these would include things like fatigue, problems breathing or shortness of breath. And also patients can develop symptoms of heart failure. Mitral regurgitation can happen for a number of reasons. And kind of put it into two different categories. One is when the mitral valve itself degenerates. Over time, as it opens and closes with each heartbeat, the valve itself can become thickened and the support structures of the valve can degenerate and the valve itself can become abnormal. And when that happens, you can have a leaky mitral valve. More recently, studies looking at patients that have a normal valve, but the heart itself is weakened to the point where it can no longer support adequate closure of the mitral valve. And this is a group of patients with what we call functional or secondary mitral regurgitation. We do this procedure under general anesthesia. Once a patient is asleep, we put a catheter into the vein in their groin, and then this is how we deliver the device to the mitral valve. When this becomes severe and a patient is symptomatic, we can use the MitraClip to repair that valve. So MitraClip is a catheter-based technology that allows us to repair the mitral valve in patients that have a leaky mitral valve without having to do the traditional route of open chest or open heart surgery. Basically, a glorified clothespin that we place on the mitral valve to help bring the leaflets together. The procedure itself typically takes an hour to maybe 2 hours, depending on the complexity of the mitral valve disease. And then the patient is monitored in the hospital, typically one night. And the next day, if they're feeling well and things look good, at the access site and on an echocardiogram, then they'll go home the very next day. And so after these procedures, patients can really go back to doing whatever they'd like. In a week's time, if they want to go for a walk, if they want to go to the gym and exercise, they can really do these things and enjoy them.
Pros and cons. For the pros, in this trial, device-based treatment results in a lower rate of hospitalization for heart failure, lower mortality, better quality of life, and functional capacity at 24-month follow-up. For the cons, we have infection, heart rhythm problems, and stroke.
Click subscribe and bell icon to get regular notifications.
Issue applied in Ecuador. In Ecuador, the impact of cardiovascular disease is quite significant. It is estimated that more than 199,000 Ecuadorians have heart failure, which corresponds to 14% of the total population. Conclusion. In conclusion, transcatheter mitral valve repair results in a lower rate of hospitalization for heart failure, and transcatheter device-related complications were nil. Thank you. Have a good night.